Hello, my name is Kate. I'll be your nurse for today. We will be completing a head-to-toe assessment. Before we begin, do you need to use the restroom?
No.
Okay. Can you tell me your name?
Kayla.
And your birthday?
4898.
Alright. Can you tell me where we are right now?
Home.
What day is it?
Sunday.
And what year is it?
2020.
Alright. If you saw someone breaking into someone's house, what would you do?
Call the police.
Alright. So patient is alert and oriented ×4. Speech is clear, spontaneous, and logical, and abstract thinking and justification are intact. Are you having any pain today?
No.
Alright. I'm going to begin by assessing your skull. So, patient's skull is normocephalic with no overt deficiencies noted. The hair is distributed evenly and clean. The scalp is intact with no overt issues noted. Looking at the patient's general appearance, the patient is well kempt and dressed appropriately for the situation, behaving appropriately to the situation. So I'm going to assess your eyes.
Okay.
Just looking, the lids are not drooping. They are symmetrical and appropriate for the patient. The lashes are fine and distributed evenly. The conjunctiva is pink and moist, and that is bilateral. The pupils are approximately a 5, and the conjunctiva is white with no varicosities or redness noted. So I'm going to have you look at my finger. Pupils are equal, round, and reactive to light. And I'm going to have you, wonderful, and they accommodate and the reaction is brisk. I'm going to have you look at this chart. I'm going to have you cover one eye.
Okay.
And in a real world situation, this would be 20 feet from you. I want you to read the smallest line you can read comfortably.
EDFCZP.
Alright, and cover the other eye and do the same.
EDFCZP.
Alright, and now with both eyes uncovered.
EDFCZP.
Alright, patient's vision appears to be 20/30 according to the chart. Alright, I'm going to assess your ears now.
Okay.
Thank you. The outside of the ear appears to be intact with no overt deficiencies noted. I'm going to assess the pinna and the tragus. Is there any pain or discomfort?
No.
Alright, nothing noted in the oracle. If I had a otoscope, I would use it to look within the inner ear, but since I don't, I'll use my pen light. I'm going to pull up and back and assess. No abnormalities noted. In the inner ear, the tympanic membrane should be gray and shiny. Similarly, if I had an ophthalmoscope, I would assess for the red reflex bilaterally in both eyes, but since I don't for video purposes, we will say that it is intact. I'm going to assess the nose.
Okay.
It is symmetrical with the face, does not appear to be broken. No overt abnormalities noted. I'll have you look up. I'm going to shine a light. The mucosa is pink and moist, and the turbines are visible. I'm going to have you close your eyes and cover one nair. And sniff and tell me what you smell.
Alcohol.
Alright, and cover the other nair. And what do you smell?
Alcohol.
Alright. So the nairs are patent. I'm going to look at your mouth. The lips are intact, pink and moist. Have you open your mouth for me? I use a tongue depressor. The hard and soft palate are both intact, pink and moist. The upper pharynx appears intact, pink and moist. The tonsils are present. All teeth are present and in good shape with no decay or caries. The tongue is midline in the mouth and it is pink and moist and intact. The oral mucosa is likewise pink, moist, and intact. So I'm going to feel your neck. I'm going to palpate. The trachea is midline with no deviations. I'm going to assess your carotid pulse. And it is +2. And assess here. It is +2. I'm going to listen for any bruise with the bell of my stethoscope. And no bruising noted. Into this water, I'm going to have you relax your neck and shoulders and swallow. Alright, the thyroid is palpable upon swallowing with no overt abnormalities noted upon palpation. I'm going to feel your lymph nodes now.
Okay.
I'm going to feel the preauricular and the postauricular, the occipital and the tonsillar, the submandibular and the submental. I feel the superficial cervical, the posterior cervical, the deep cervical chain, and the supraclavicular and the subclavicular. Any tenderness? Okay. Lymph nodes are not enlarged or swollen with no tenderness. I'm going to feel your distal lymph nodes now. So I'm going to assess the lateral lymph nodes up to the central, the pectoral. Assess the subscapular and the infraclavicular. Any tenderness?
No.
Alright, they are non-palpable with no tenderness. Alright, so I'm going to observe your breathing. It is regular and unlabored. No problems noted with the rate or rhythm. I'm going to have you turn with your back towards the camera.
Okay.
Alright, you can see the AP is 1 to 2, which is symmetrical and even. Feel me touch. Take a deep breath. Alright, chest rises symmetrical bilaterally. I'm going to percuss. Alright, and again. Alright, and it is resonant as is to be expected. Now I will auscultate and have you just breathe normally.
Okay.
Alright, breath sounds are clear and equal bilaterally. I'm going to assess the spine. The spine use processes, and they are no abnormalities noted. They are palpable to touch. Any pain anywhere on the back?
No.
Wonderful. I'll have you turn back around. I'm going to assess your breathing for a minute. Just breathe normally. Respirations are 15 with the depth and pattern regular and unlabored. No visible retractions. I'm going to assess for CVA tenderness. Any tenderness?
No.
Okay, none noted. I'm going to have you lay back for me.
Okay.
to listen to your lungs anteriorly.
Okay.
Regular deep breaths. Alright, the breath sounds are clear and equal bilaterally. I'm going to feel in chest any pain or discomfort. I'll have you kind of roll that way for me a little bit and feel the same. And feel here. PMS +2. I'm going to assess your heart sounds, so I'll listen to the valves of your heart, and I'll be listening to your apical pulse for 1 minute.
Okay.
So I'm going to listen to the aortic with both the bell and the diaphragm to assess for any bruits. The pulmonic. Erb's point. The tricuspid. I'm going to listen to your apical pulse for 1 minute.
Okay.
I'll listen with the bell.
Okay.
Alright. S1 and S2 are noted at all points with no bruise noted. The apical pulse is regular with a rate of 65. Let's see. I'm going to assess your abdomen.
Okay.
Visibly, the skin is intact and without discoloration. No bulges or retractions noted. I'm going to percuss.
Okay.
And the sound is tympanic. I'm going to auscultate each quadrant. Dial sounds were audible and normal active. I'm going to lightly palpate.
Okay.
Any pain or tenderness in
No.
any quadrant? Okay. I'm going to do deep palpation. Any pain or tenderness?
No.
Okay. Palpate the liver. It is non-palpable. Let's see. You're going to feel me press. Is there any tenderness on rebound?
No.
Okay, no tenderness on rebound noted. I'm going to assess your upper extremities if you'd like to cover yourself.
Okay.
While we're here, the skin of the upper extremities is intact and without discoloration. I'm going to assess the pulse, the brachial pulse, which is +2, and the radial pulse, which is +2. And do the same bilaterally. Alright, I'm going to assess the nails. They are without curvature and without any overt deformities. I'm going to assess capillary refill, and it is less than 3 seconds bilaterally. I'm going to listen to the arteries in your stomach, the abdominal,
Okay.
the renal, and the femoral. Okay. No abnormalities noted, no bruits, and femoral pulses are +2. I'm going to assess your legs if you want to just uncover them. The bilateral lower extremities are also without discoloration and the skin is intact. There appear to be no varicosities. There appears to be no edema. Skin overall is cool to touch. I'm going to assess the posterior tibial pulses and the dorsalis pedis pulses. And they are +2 bilaterally for both. I'm going to assess the capillary refill, which is less than 3 bilaterally. If you want to go ahead and sit up, I'm going to assess your cranial nerves.
Okay.
We will begin with the olfactory nerves. If you'll close your eyes again.
Okay.
And just tell me what you smell.
Alcohol.
All right. Second we will check is the optic nerve. So I will have you look directly at me. How many fingers am I holding up?
2.
Okay. And here.
2.
And here.
4.
And here.
5.
Okay, so both the olfactory and the optic nerves are intact. I'm going to assess the oculomotor nerve. I'm going to have you focus on my finger and follow it with just your eyes.
Okay.
So the oculomotor nerve is intact. I'm going to have you close your eye, or close one eye,
Okay.
and focus on my finger and uncover. All right, and do the same with the other eye. Focus and uncover. The abducens nerve is intact. I'm going to have you clench your jaw. And I'm going to palpate any pain or tenderness here. No pain, tenderness?
No.
Okay. I want you to close your eyes again. You're going to feel me touch. How does that touch feel?
Soft.
And here,
Soft.
and here,
Soft.
and here,
Sharp.
here,
Sharp.
and here.
Sharp.
All right. I'm going to have you smile for me, frown for me, lift your eyebrows, and pucker up your lips. Okay, so the facial nerve is intact. For the auditory nerve, I would use a tine and perform the Weber and the Rhine tests. So with the tuning fork, with the Weber test, I would place it midline of the skull. With the Rhine test, I would place it at the mastoid process and near the ear. Since I do not have one, we will say that this is appropriate, and I will perform the whisper test instead. So I will have you close your eyes and cover one ear.
Okay.
I'm going to whisper a word, and I want you to tell me what I say. Football.
Football.
Okay. And the other, grape.
Grape.
All right. So that is intact. For the trigeminal nerve, I want you to follow my finger and hold that. And there is no nystagmus noted. For the glossopharyngeal and the vagus nerve, I want you to open your mouth, please.
Okay.
And stick out your tongue and say ah. All right, swallow. All right. And so swallow reflex is intact, gag reflex is intact, and both the glossopharyngeal and the vagus nerves are intact. I want you to lift your hands against my shoulders, or lift your shoulders against my hands, and then turn against the pressure to your head. Again. All right, the spinal nerve is intact, and this also assesses the sternocleidomastoid nerve and the trapezius, or the muscle and the trapezius muscles, both of which have a grade of +2 or +5. My apologies. Finally, I want you to stick your tongue out for me.
Okay.
And wiggle it side to side, up and down. All right, so the hypoglossal nerve is intact. So all 12 cranial nerves are intact and functioning appropriately. And at this time, I will take a look at my paper. Okay. So at this time, I'm gonna have you stand.
Okay.
I'm gonna assess the shoulders and the iliac crest. No physical abnormality noted. They appear symmetrical and equal bilaterally. I'm going to have you turn towards the camera, or turn your back towards the camera. Yes, my apologies. I'm going to assess the curvature of the spine, the cervical, the thoracic, and the lumbar. No lordosis or kyphoidosis noted. I'll have you bend forward with your arms hanging loosely. And there is no scoliosis noted either. Wonderful. So I'm going to have you walk towards the camera and back. All right, the gait is even and balanced with no physical difficulties noted. I'm going to have you close your eyes and try to stay still. The Romberg test is passed with minimal swaying. I'm going to have you walk heel to toe, just a few steps and then a few steps back. Wonderful. And I'm going to have you stand on one foot and the other. Wonderful. Gait and balance are fully intact. I'm going to have you look straight up and turn your head side to side, up and down. Range of motion in the head and neck are intact. I'm going to feel your jaw and have you open and close. No crepitus noted, and the full range of motion of the jaw is intact. We'll do your shoulders. Roll again, shrug and down, roll. All right, and we'll do the elbows, bend and unbend. Wonderful. We'll do the wrists. All right, and we'll do the fingers. Wonderful. No crepitus noted upon palpation. Full range of motion appears to be intact. I will have you do your fingers to your thumb. All right, and then your finger to your nose. Right, fine motor skills appear to be intact. I will have you sit for this portion. Wonderful. And I'm going to feel again. There was no warmth noted at any joint, any discomfort or tenderness in your joints. The joints appear symmetrical without discoloration or disfiguration. I'm going to have you pull and push. All right, muscle strength is grade 5+, equal bilaterally. And we're going to do the same here. I'm going to assess your joints here and here, your ankle, and wiggle your toes. And we'll do this bilaterally. Ankle and toes, and I can see that the hips move evenly and appropriately. There's no crepitus noted on any joint, no warmth or tenderness, no overt defects of any joint. I'm going to have you pull against me and push against me. All right, muscle strength would be a grade of 5+ for both. I am going to, if I had a reflex hammer, I would test the deep tendon reflexes with that. Since I do not, I will mind doing so with this pin light. I'm going to test the brachioradialis. The bicep I'll do on this side so you can see better. The bicep and the tricep. Then we will do the patellar reflex and the Achilles. And we would give them appropriate muscle grades based on what the actual assessment will be with the appropriate equipment. So I'm going to once again look at my paper for my second look. Right. So I'm going to have you close your eyes.
Okay.
I'm going to roll up your sleeves.
Okay.
Okay, with your eyes closed, I want you to tell me how this touch feels.
Soft.
And here,
Soft.
here,
Soft.
and here.
Soft.
And now?
Sharp. Sharp.
Okay.
Sharp. Sharp.
Okay. So sensation is attacked in both bilateral upper extremities. And then we'll do the same. Close your eyes. How does this
Soft.
feel?
Soft.
Okay.
Soft. Soft. Sharp. 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 Sharp.
All right, so it is also intact in the bilateral lower extremities. I'm gonna have you lift your foot. The plantar reflex, the Babinski reflex is intact. If it were not, the toes would be fanned out. So, sensations are intact on both bilateral upper and lower extremities. I'm gonna have you close your eyes and hold out your palms. I'm going to trace a number or letter on each palm, and I want you to tell me what I've traced, all right?
Okay. An O
Okay,
or a 0.
correct.
An 8.
All right, that is correct. So that is the graphonesis. And then I'm going to have you close your eyes.
Okay.
And I'm going to place some objects on your palm. I want you to tell me what they are. So grasp that object.
A key.
Correct.
A coin.
Correct.
A bobby pin.
Correct.
A key.
Correct. So stereognosis is intact. Do you have any questions or concerns
No.
concluding this exam?
No.
All right, that concludes my physical assessment. Thank you very much for your time.
Thank you.